Good afternoon, everybody, and you're very welcome to today's meeting, which is co-hosted by Kilkenny Rotary and Kilkenny Chamber of Commerce. We're joined, first of all, by Professor James McInerney, Head of Life Science at Nottingham University. Dr. McInerney, you are very welcome to us today. It's a long way from Nottingham, Bunratty, but you've taken quite a route to get to Nottingham. You've been in a number of different universities, both in Ireland and in other countries. Can you just give us a little bit of your academic history, and particularly what drew you from a farm in County Clare to a world of high academic science?
Well, there's hardly a place in the world that's more scientific than a farm, to be honest. I mean, I have childhood memories of going out and picking up soil samples, for them to be chemically analysed. The genetics of field crops are always important. You're always trying to pick the best bull and cow combination, and that's genetics right there. And so, farming is very scientific. I mean, so I think you grow up understanding that science can change things and can improve crops, can improve cattle, can improve way of life, can improve your income and all those kinds of things. So have an appreciation for farming is something that you do pick up in a farm. Sorry, appreciation for science is something you do pick up in a farm. So I went off to Galway, did a science degree in Galway. I was pretty convinced that I was going to either study physics or chemistry, until this guy called Jim Houghton in Galway gave 6 lectures in genetics. And I thought, that's it, that's the one I want to do. And I did very badly in biology in first year, but I picked up after that. I stayed in Galway for about 8 years, then doing a PhD. I went off to London. I worked at the Natural History Museum for about 4 years. And I came back and I was in Maynooth for 16 years. Not in the seminary. I didn't become a priest or anything. But I was in Maynooth, and I don't know, midlife crisis, I haven't a clue why. At some point I said I'm off for a bit of an adventure. So I spent a year in Harvard at the Harvard School of Public Health, where I met a lot of the infectious disease epidemiologists that you hear about and see on the media right now. I mean, it was a really great place to be. So when I came back to Ireland, I couldn't really settle anymore. So then I picked up a position in Manchester, leading a big sort of research part of Manchester University. And then Nottingham came calling, and so I came to Nottingham to head up the School of Life Sciences. So yeah, it was just I think mid-career I got a bit sort of itchy feet and left.
Then the title of your post at the moment is Head of Life Sciences. That sounds a very broad title. What does it involve?
So we're one of the largest schools of life sciences in the country. So I would have an annual budget of £35 million to spend. And most of that, about 80% of that, is in salaries. And I'm charged with delivering 2 things. One is excellence in teaching, and the other is excellence in research.
Right.
The research part of our budget's about 12.5 to 14 million a year, depending on whether it's a good year or a bad year. This year was a bit low, it was about 9.5 million, mostly because, of course, no one's at work for a lot of the year, and they're at home, and we're not spending budget, and we're not doing things that we hoped we'd do. So life sciences, we would have everything from human physiology, so people trying to understand when you eat a chocolate bar, what does it do to you? Does it, what's the long-term effects of this diet versus that diet? We've got a big microbiology group investigating everything from, indeed, viruses like the coronavirus that's going around right now, to sleeping sickness, to new antibiotics, trying to understand antibiotic resistance mechanisms in bacteria, all of those kinds of things. We've got the immunologists, so they're trying to understand the way in which the immune system responds to challenge of various kinds, including infectious diseases. And so our immunologists and our virologists have been in work every day. They didn't get to be furloughed, and they weren't told to stay at home because they were working on COVID. And so they were in every day. Our immunologists trying to understand how COVID interacts with the immune system, and our virologists trying to understand COVID itself, what exactly is that. We've got a big genomics and genetics section. We've got an ecology group or set of groups that are trying to understand things like response to climate change and how that might work, who are going to be the winners, who are going to be the losers when climate changes. We've got a pain center, so they're investigating one thing and one thing only, and that's pain, mostly with a view to mitigating pain and trying to reduce the effect of pain on children, actually quite often, but elsewhere as well. We've got people that are trying to look at alternatives to animals in experimentation.
Oh,
very much. Okay.
So I think I'll probably stop. I could keep going on with you.
I wonder, could people mute themselves, please? Could you mute yourself, Eamon? If everyone could mute themselves so that we can hear James.
Yeah, Ian, I think you have the facility to mute all of us. Actually, do you?
No, but I don't want to mute James.
And James could unmute himself then if he wanted to.
Right,
that. Yeah.
I'll just mute. Okay, we just go ahead with what we've got.
Yeah. Okay. We tend to think that we do everything from almost the subatomic to the astronomic in the school. And it leads into other things like our School of Pharmacy, our School of Medicine. We don't really do much of the agricultural stuff. There's another campus that's about 5 miles from here that deals with agricultural stuff. So we don't do all the life sciences. They do some, and our vet school is a different school as well. But we do a lot of work with the vet school. So if it lives, we tend to be interested in it.
You mentioned there sleeping sickness and vaccine, and there was a vaccine for the swine flu that in Ireland introduced sleeping sickness amongst a number of people who took that vaccine. And that brings me around to the question that a lot of people might have about the current pandemic and the effectiveness of vaccines and the regulation that goes into assessing it and ultimately approving it. Most drug companies are there to make profits. And profit can, as we found in the very few vaccine or medications that did have problems, but that's what sticks in people's minds, problems. And there might only be 1% chance or whatever of something going wrong, but they will think of the 1% and not the 99% success rate. When I was talking to you earlier today, you mentioned that the code for the current vaccine was devised some time ago and that the testing has been taking place ever since. Could you tell us a bit about how the virus emerged and how a vaccine was so quickly designed, even though it's taken a long time to go through the assessment and testing process?
Okay, so there were a lot of things in there. One is, can I just go back to the 2009 swine flu outbreak and the claims of people who afterwards felt that the vaccine caused them to be unwell. None of those were ever proven. It was not proven that did that, but there were many, many payouts. So there's a difference between what an insurance company are happy to pay out and what scientists would say, fulfills the obligations of a particular burden of proof. So I don't think the scientists were completely convinced by these claims, but that's totally different to a legal system that are happy to pay out, or insurance companies that just want this gone. But so that's one. The second thing is that nothing in life is absolutely guaranteed.
I know.
So, but we can quantify things. So you were saying 1% in terms of vaccines, but if we add up all of the vaccines and all of what we call, so there's a few different things that you think about when you think of a vaccine, but probably the ones you think about are whether there's a mild adverse reaction or a strong adverse reaction. Those are the things that frighten people. Mild adverse reaction, this current vaccine is producing mild adverse reactions. Two main ones. One is headache and the other is soreness at the point of injection. I think it's important that we say that, right? It's an intramuscular injection. Okay, so and also you're trying to stimulate the immune response. So people are reporting that it's a bit on the severe side for a vaccine. However, after 43,000 people have gone through a clinical trial, we've got nobody that was hospitalized as a consequence of the vaccine so far. That doesn't mean that there will never be anybody, but it gives you an idea of the fraction, the upper bound, if you like, of the fraction of people that might have an adverse reaction. So far it's 0 out of a lot of people. When you get your first severe adverse reaction, I don't know, or if you ever get one,
Yes.
I don't know.
Yeah.
If 43,000 people got COVID, you would have several hundred deaths. I can say that for certain.
Yes.
So the question is, when you weigh these two against each other, a live virus versus a vaccine, the vaccine is at least 100, at least probably 1,000, maybe 10,000, and maybe 1,000,000 times safer option for a person when the alternative is to sit around and wait for it to infect you with a live virus. So it's a matter of not absolutes, but of calculating risk and of understanding that risk. And I think for me, I think the important thing is that people understand these risks. Long term, in terms of vaccines, I saw a good number today, which is the likelihood that a person will be hit by lightning versus the likelihood that they will have an adverse reaction to a vaccine. Being hit by lightning is a 1 in 700,000 chance in your lifetime. An adverse reaction from a vaccine is 1 in 760,000. And that's for all vaccines going back along while vaccines have been around. So it's less likely that you get an adverse reaction than if you were to be hit by lightning, but it's not 0.
Yes. And I mean, nothing in life is certain in any case. But going back to how quickly this vaccine was developed, it seems extremely fast. I know all the best minds in the world were focused on this because this is a global problem. But it's still miraculous that so much has been achieved in what is relatively a short time.
Yeah, I have never seen science working like this in my entire life. I'll give you an example, maybe a little bit different to this. So if I publish a scientific paper, then I wait for the other scientific papers to cite my paper. And then I can start counting, and if my paper was really good, then 100 papers in the future would cite it, right? And so on. This required virtually every pharmacologist, immunologist, microbiologist, virologist, geneticist in the world to stop what they were doing and work on this. I saw papers published on a Wednesday that had 600 citations by Friday. 600 other publications had been published within 2 days that cited that one on Wednesday. I've never seen science work like this, and it'll never work like this in anything again. What you've seen is science working in a situation where funding was virtually unlimited. The first thing that you do if you think you've got a new vaccine candidate or drug candidate is you spend the next 2 years looking for money to go do the research into it. You get it to a stage then after a while where you go to a clinical trial. And do you ever go to a hospital and beside the lift, there'll be this page, and on the bottom of it, are you between the age of 45 and 65 in good health and you used to smoke at one stage? Tear off the bit on the bottom, phone this number, and can you help us with the trial? Or if you ever go in the London Underground and you see the signs there, we're always looking for them. And you could spend years and years and years trying to get enough people to form a clinical trial. For COVID, I signed up. They never called me. They had too many.
Yeah.
They had too many middle-aged white men, right? And too many of everything. They had too much money. They had too much everything.
Yeah.
So what they decided to do is they decided to effectively really risk the money. And so once you got something past the first stage, and the first stage is 200 volunteers, and you're really not testing whether it's a good vaccine or a bad vaccine, you're testing safety only. In 200 people, did you have an adverse reaction? If the answer is yes, you go no further with that. So they did it with this one, and they've done it with 200 different vaccine candidates, and we call them different kinds of platforms. This one is an RNA platform, which is a very new kind of platform, but there's lots of other ones. So there's 200 candidates. So once it got past that, they ran all the rest in parallel. So normally you go from there and you scale up, and if you're really, really lucky, you go from 200 to maybe about 600 or 1,000. They went straight. This trial wasn't even the biggest trial. It had 43,000. The current vaccine that's rolled out across the UK. But there have been trials of 60,000. Never seen that before. And they ran those trials, and also they initiated manufacturing of millions of doses at the same time. And so those doses, if the trial wasn't successful, would all have to be burned, costing hundreds of millions of dollars. And they got the money. There was no question. They got the money from governments, from philanthropy, from non-profits, and so on. So they got the money. So you're right. You've never seen a vaccine develop so fast, but you've never seen so much money go into it. You've never had ever seen a vaccine being developed by literally millions of scientists who dropped what they were doing to go do it. And you've never seen the willingness to lose money ever like you've seen in this. And the Gates Foundation put in $200 million and said, look, if this doesn't work, we don't care.
Yeah.
But then you get to the stage where the regulator comes along and says, I want to see the results of your vaccine candidate. And of course, Boris Johnson here in the UK was really hoping that the Oxford vaccine would be it. And he talked about it. But the British regulator sent them back and said, your clinical trial isn't good enough. You don't have enough diversity of people in there. And they sent them right back. And the one they've approved in the UK is not the British one. It's the American-German one. So, the regulators are not under pressure to fly the flag or to get this done in time. I fully believe they looked at the data of one of the biggest clinical trials of all time, and the data is good. And it's only on the basis of the data that they're rolling it out. And I'm quite sure that the European Medicines Agency will roll it out. The 10th, which is 3 days' time, is when America is having their hearing on whether they're going to roll out this particular Pfizer vaccine. But it happened very, very fast because everything ran in parallel with unlimited money. But I don't think that they bypassed the kind of numbers that we need to see in a vaccine. And remember, if they get wrong, confidence in vaccines forevermore will be shot.
Indeed.
You'll never, ever have a vaccine again. So even Pfizer don't want this one big vaccine at the expense of all the other ones that they've got in their pipeline. So no one wants to get this wrong. It's important not to. So I don't believe that they've done anything wrong in doing this quickly. They've just done it quickly because it had to be done.
Yeah, but again, it's better right than rushed. And one person has come in with a question. Gordon Murphy has a question. Is there any scientific basis to estimate how long the vaccine will be effective? For someone who gets COVID, how long will they hold the antibodies? So that's two questions there.
Yeah, so the answer is we don't know with absolute certainty that question. The answer to that question, we don't know. What is most likely is that you will have a distribution with some people. So we know that some people, their immune system didn't actually kick in. It didn't at all, right? So about 5%, 1 in 20, didn't get protection from the vaccine, but the rest did. And we do know that some people then, they've done a study on the antibody load, the antibody titer, we would call it, in the blood. And that dropped in about 20% of people after some months. But we also know that some people got live COVID, of course, in March and so on, and they still have high antibody counts, they still have a strong T-cell response and so on. So they're doing well. So I think the answer will be you'll see a distribution from some people having protection for a long time, and I couldn't estimate how long because we simply don't know, and other people for a shorter amount of time, which is kind of why you want a decent uptake in the population for it to be useful.
Yes, I mean, it's mass vaccination, not a selective vaccination.
No.
There's one other question I'd like to ask. People talk about the negative effects of vaccines, but have there been any unexpected positive outcomes from the testing that has been done that might affect other illnesses apart from COVID?
Oh, well, the current vaccine that's being rolled out is what's called an mRNA vaccine. So you've never seen a vaccine like this before. And part of the reason that it got rolled out so quickly, it's a new platform, it's a new kind of technology. But the reason that's the first one is because this technology could be very, very precise, very safe, and very, very quick. So if you're to say something good came, it was that this new platform got the full test. It got the proof of concept, and I have a feeling that into the future, the flu vaccines, all of the other ones, well, maybe not all, many other vaccines will be developed using this approach, and this approach will be cheaper, faster, and theoretically it should be safer. And so far in the tests, it has proved itself to be quite safe. So if there's a positive, it's that. It is that the world now has the ability to develop a vaccine from a genetic sequence of whatever is attacking us, to having it in freezers ready to go in sort of 9 months. Yeah, which is So if there's a positive, that's probably it.
The big problem that is unexpected, but at the same time it's emerging, is the anti-vaccination lobby. People who believe that, and this has affected us in Rotary. We've been involved for years in the elimination of polio, and that's been relatively successful. It hasn't been entirely successful because there are still 2 countries where the virus is rampant, and that's Afghanistan and Pakistan, where religious leaders, religious fundamentalists are stating mistruths about vaccination, and that has inhibited the take-up in just those 2 countries. We finally eliminated it in all of Africa in 2020, after nearly 40 years of a vaccination program. Is this something that can be countered by common sense?
I think fact should counter it as well. I mean, I was on primetime the other night, and one thing I said was, or I can't remember when I said it anyway, don't believe, this because it comes from a professor or from, a politician or whatever. Take a look at the numbers, and if you say to somebody, well, I think it's too dangerous, then they need to explain to you how, after tens of thousands of people have gotten it and there's been no severe adverse reaction, compared to if tens of thousands of people had got COVID, we know that there would be deaths, many of them, and long COVID, people that are sick for a long, long time. We know. How do you compare those 2 and still say you're against the vaccine? How do you do that? And they have to explain some very strange logic in order for them to say that this is a rational way to approach it. So what I do is I say to people, you need to provide me with the alternative explanation, and then what you hear are things like thalidomide and so on.
Yes,
thalidomide was a major mess up, but thalidomide was developed at a time when people thought that smoking cigarettes was good for you.
indeed.
I present people with the facts, and I say, well, can you explain these facts in a way that says that the vaccine is more dangerous than the live virus? And you just simply can't. You simply cannot.
Yeah, I mean, there are some more questions coming in. Is there a value to the individual or society in getting more than 1 vaccine?
No, you should. I think that hasn't been tested. Getting more than 1 vaccine, I would be reluctant to get more than 1 vaccine. I would say that if this 1 vaccine offers you protection, that I would stay with that, simply because you're challenging the immune system, and no one's tested 2 different challenges to the immune system, would say, from the same sort of type of virus. So I would say just do 1.
Yeah,
it hasn't been tested. There's also a contraindication for pregnant women, but the issue there is, of course, you don't run a clinical trial where you recruit pregnant women. Pregnancy is a particular issue for the immune system as well. The immune system gets rid of anything from your body that it thinks is not part of you. And so, of course, a baby is not part of you. So the immune system has to go through enormous gymnastics in order to keep a pregnancy going, right? And so you don't recruit pregnant women. And so the answer, they're saying, to pregnant women, don't take this. Or if you think that you're going to be pregnant within weeks of taking the vaccine, then don't take the vaccine, and so on. And that's really not because they think it will do bad things to pregnant women, but they just don't trial it on that, and they don't know. So if it hasn't been trialed, then I don't advise it. So 2 shots of 2 different vaccines hasn't been trialed, so I wouldn't advise it.
Yes, and one could shoot down the other. It just is not.
Yeah, or you get these kind of snowballing effects as well, where the immune system goes into overdrive. Things like arthritis and so on are a form of your own immune system attacking yourself because it's gone into overdrive. So I certainly would not try to do things like that.
Yeah. One person has asked, it has been developed very quickly. It's more efficacious than others. It works well in the elderly, which others don't. Is it too good to be true?
Oh, that's a good question. Oh, certainly, it's far better than we anticipated and imagined. It's better than most flu vaccines. Is it too good to be true? So that's a really good question, because the numbers that have come back, you calculate this 95% efficacy based upon the control group and the virus group. And 43,000 isn't the full number. And a small number of positives on either side would affect that 95%. So you'll know the real number, when 1 million, 10 million people have been vaccinated. You'll know the real percent efficacy, and long term as well, over a period of time. So right now, the numbers that you're hearing are just the start numbers from that one study. The real numbers will be known in the fullness of time. Is it too good to be true? Well, it's a very good vaccine, yeah. That's all I can say about it. Those are the numbers from the trial that was done.
Yeah. And at what level of the population being vaccinated can we expect life to return to normal?
That's a good question, right? My phone is
Colin Ahern, by the way,
here beside me, and all it's doing is hopping on for people saying, what will January be like? What will February be like? Right. Right now, so trying to estimate it, Ireland has done too good a job. So you've got far fewer people with COVID antibodies than places like the UK, which did a terrible job in sort of controlling the virus. So the UK will have more people, would you believe, that are already resistant. And so imagine what we're doing is a network, right? And the nodes in the network are people, and they might transmit on to their connections in the network. And what the vaccine does, or what an immune system that prevents you from being infected does, means that you can neither receive the virus nor pass it on, right? And so you have the combination of people who are already immune from having gotten the virus, and then you're going to introduce the vaccine, and you'll have that kind of uptake. And most people, I think, that are getting the vaccine will soon, sort of be causing a dead end in that network of transmission. So I'm anticipating that in 3 months' time, we'll have made a significant dent in the transmission rates around the community. I think that if the rollout is as good as I hope it will be, I know an awful lot of people who are just waiting to get it. I know an awful lot of older people that have said, yes, I'm very happy to take this. And so there'll be about 5 things you'll look at for life to get back to normal. What's the frequency of the virus in the population? What's the frequency among the older, more susceptible people and the susceptible groups? Is it going up or is it going down? Okay, so is the frequency going, in other words, is behavior causing it to go up? Are people sort of saying, oh, there's a vaccine here, now I'm off to the pub, right? Is that going to start happening more? Will people be able to control their behavior for some time? The uptake of the vaccine will be important, and so on. If you had a good, strong tailwind and everybody was doing what they were told, honestly, you could almost be having a nice St. Patrick's Day.
Right.
If not, then no. If there isn't good take-up, if those that are not vaccinated are allowing the incidence to increase, then maybe not.
Yeah. We're part of the rich world, and vaccinations will be brought to this country, will be bought and distributed. What about poorer countries, third world countries, where their health system is already under strain?
Yeah. So there are 200 vaccines under development right now, and one of the big drivers is to get a vaccine that can survive for a long time at room temperature. So therefore, you can distribute it into rural India, places that are hard to reach, and so on. But the one thing this year has taught us is that this virus being anywhere on the planet is our problem. We are all ready, willing, and able to bring whatever infectious disease we have anywhere in the planet in 24 hours. We know that. And the big danger in the future are reservoirs or pockets of this virus and it not going away. And if, as somebody asked earlier on, if our immune system needs a booster, or if it dips down after some years and we no longer retain resistance to the coronavirus, then that becomes this long-term problem that we have. So that's on one side. So I think it's very important, to really make sure that that access to the vaccine is not dependent on your wealth, because it's everybody's problem. So that's number one. The second thing to say is the continent of Africa and places like India are far younger than we are here. And so the same rule seems to be applying everywhere, that younger populations are less susceptible to strong effects from the coronavirus. So this it goes both ways. You will see on the continent of Africa, people will have much milder symptoms, populations will in general, but also you'll find difficulty rolling out a vaccine there as well.
Yeah. James, I'm conscious that you have to go. There are more than us making demands on you, but I really very much appreciate all that you've said to us today and given us hope, I think, which is, that great commodity that you can't put a price on. I'd like to call on Colin Ahern, the president of the Kilkenny Chamber of Commerce, to say farewell to you on behalf of Kilkenny Chamber.
Yeah, thanks, Ian, and thanks, James. That was, really, really interesting. So many questions, so little time. It's great to have an Irishman over in the UK leading all of this and leading his field. So we're very appreciative. We know how busy you are and how much everyone wants to speak to you. So thank you very much. And I'm sure, look, if people have more questions, send them in and perhaps we can get an answer at a later date. But thank you very much for your time.
No worries, no worries. Thank you all very much. And take care.
And I'll send you a recording of today's session so that it'll be there for posterity. Thank you again, James.
Thank you very much.
Thank you, Claire, for introducing us today.
Hello to Quinn, my daughter, who's possibly in Loretto, joining us on the Interact Club in Loretto as well. So, James, you can say hi to your niece, Quinn, there.
Quinn.
Quite a few joining us.
Yeah, there she is. Hi, everyone from Loretto.
100% mortified.
Good, that's the whole intention. Thanks, Elaine. Okay, thanks, James. And I hope that perhaps when all of this is over, that you might come back to us and talk about things that are not quite so current. And we can look at how science affects all of our lives. And thank you very much for being so eloquent and erudite on a topic that really is a worry for everyone. Thanks again, James.
No worries, and come on the banner. Bye.
Cheers. And now going to call on Paula Lawler. Paula is joining us by voice, I think, today. Are you there, Paula?
I am, Ian. Can you hear me?
We can hear you loud and clear.
Listen, huge apologies. I've been on Zoom all morning and I thought it was Microsoft meetings and I just cannot get my camera to work. I've done all the typical troubleshooting and it still won't work for me. So
don't worry. Listen,
apologies.
We can hear you, and that's really all that matters at the moment. Because what is your title with YuleFest at the moment?
So, Ian, just to explain to everybody, good afternoon. I have worked closely with the council for the last 4 years on building up YuleFest Kilkenny. So this year, I've always had the title of Festival Director. So It's the same for this year, even though it's been a massive challenge to me to be a Festival Director. I don't know if it's a reflection of my age now or anything, Ian, but I suppose I had to come to terms with something that is very full-on events. I'm so used to engaging with people. I get so excited about crowds, concerts, lots of people lacing up the runners and running for charity, filling venues. So for me to try and get my head around Christmas virtually was a big ask. Yes,
but they did ask you and you stepped up to the plate.
Well, I did. And look at, I suppose really the difficult thing was not only just separate from me trying to figure out how would we work our way around a festival that would engage people. You wanted to support Kilkenny City and county. You wanted to get people to be part of something. And at the same time, you didn't want a crowd anywhere. So that was the biggest challenge. And in fact, we launched the festival in the Medieval Mile Museum, switched on the lights at the parade on the Friday the 27th, and literally I know Broderick's unfortunately just piped out some very festive atmospheric music, and out of nowhere there was a crowd on the parade. So in fairness to the mayor, he addressed it immediately and reminded people of the space we're in at the moment, and it would normally be a promoted event and Indeed. We would welcome as many people as we possibly could. Last year we had Mary Fitzgerald and Santa switch on the trees with the mayor, and I would say there was close on 2,000 or more people there. So
I was one of them.
Yeah. And in fairness, I suppose from our perspective, that's always been, we want people to come in and be part of the switching on of the lights, because I think the first year I started, there might have been a half dozen people there. And it's something we've built up over the last few years, the momentum of getting people in Kilkenny engaged with YuleFest Kilkenny and taking ownership for the festival for their own. Even though we want to bring people into the city every year, we want to stimulate the businesses. And look, it'll be a little bit more difficult this year, but we'll be doing it.
But what will you be doing?
Okay, so I suppose first it's important to highlight, and I would imagine most people have maybe seen or aware of the new lighting investment that went into Kilkenny. So that was a huge
major investment. And this, we were talking earlier about things that the Chamber does, that Rotary does behind the scenes. It didn't just happen. That was a major investment.
Absolutely. Well, I obviously wouldn't have happened at all without money. Is everything, Ian, you know, and in fairness, Leader came very much up to the table and put a huge investment in there, and the Chamber facilitated that happening. So there was a whole application process so it is really between the council, the Chamber and Leader, and the result has been fantastic because lighting is a huge, huge cost, but it creates atmosphere. The city is aesthetically pleasing. And what we're doing is capturing all that just in terms of what part are we doing to sort of sell Kilkenny. We have a lot of photography, videography, and just capturing all of that. And that'll be showcased out online through the website. All of the normal social media platforms will be there engaging with people. And really, to keep people looking at Kilkenny, even if they can't visit this year, I'm hoping that they're looking in and saying, what a beautiful, atmospheric, special, festive space, and that will be on our calendar for next year.
Brilliant. I mean, it's a bit like what we're doing at the moment in having guest speakers coming by Zoom. It's not so much all that they have to offer as keeping the link going, keeping Rotary going, keeping the Chamber going, keeping that connectivity with members. And YuleFest does something unique in that it highlights all that is good around Kilkenny. And Kilkenny is unusual in that it's an inland city, an inland urban area. Most of the tourist areas in Ireland are at the seashore, and Kilkenny has always relied on people coming to it outside of weather dictated holiday times. Events like the Savour Kilkenny, the Kilkenny Arts Festival, the Kilkenomics Festival, the Subtitle Festival, the all of the festivals that have added to the vitality of Kilkenny. And YuleFest is there as well. YuleFest is different to what the Winterval that they run in Waterford or to other festivals in that it brings communities together. It brings events that might have been organised individually, bring them all under the one banner, and therefore create a better sense of community that is not just good for visitors, but especially good for people living in Kilkenny all the time.
Absolutely. And I suppose one of the core initiatives of the festival at the start was, you know, it was the 1 month on the calendar year, and quite rightly you point out Kilkenny is full on with festivals right throughout the year. There's something I think pretty much every month, and December was the one area that they hadn't focused on as I suppose the council or the city. So that was the main reason, and it was to stimulate the business and get people coming in and spending. But equally, a big part of that, when you broke it down, what else do we want to do? We want people to own Kilkenny. We want people to get involved, and the community-led projects, which is something that I suppose has really the element of the festival that has gained us so much momentum and positive PR. For example, last year, when I spoke to RT's senior researcher, Renda Sheedy, we were featured 3 times, Ian, and the reason we got that coverage is exactly as you said, that Renda said we're doing something uniquely different about the community. It is taking out the commerciality of Christmas, which is a very strong focus for everybody else. And I think there are the elements of the festival that are hugely important. While they might not put money in a till, they definitely put the spotlight on Kilkenny as a people that come together and do something very, very different. So that's a really, really big part of it. And we're continuing to make that in a different way happen this year. And just to kind of give you a little bit of an idea, I felt, okay, well, we can't all physically connect. And a lot of those community projects are about building something. For example, the pieces that got all of that RT coverage last year was the sustainability and the greening of the festival. And that was facilitated through workshops, carried out at schools across the city and county and in partnership with Cartoon Saloon. And we brought life to the windows for anybody that mightn't be familiar with the project, and we called it Winter Wonderland. And it was a beautiful piece of work, and we were involved with local artists as well, just to support, again, Kilkenny talent. This year we decided, you know, we can't engage with the schools, we can't go into the school, how are we going to involve them? So we're doing a Santa surprise, and the schools are getting involved with this. We're doing this in partnership with KCLR. We have a month-long campaign, and so they'll ring in to the station and they'll have a chat with Santa, they'll send in their material. They're all raising money for charity as well, because the charity element as well is a huge part for us, because we've impacted the raising of so much funds for lots of different charities each year. But with the schools then, we decided what are the other really important parts of the community for us. And that was also to reach out to the elderly. So we're doing a really nostalgic piece with the nursing homes, and we've worked with Goran Abbey, and we're talking to people just about their life and, you know, Christmas for them, or just life in general, and sharing stories. So a lot of it is about engaging the young and the old and making a space for everybody to engage on radio, because I think we've all really depended on it this year, and we've really reached more locally into, I suppose, local communications rather than the national communication. And I felt the sound of somebody's voice and hearing stories, and even the spirits being lifted of children, the reaction from the principals from school, the reactions from the nursing homes. And then we added another piece. We're reaching out to the diaspora abroad, and those interviews started last week as well, because so many can't come home and connect. So everything this year is really about connecting people, the young, the old, the ones who can't be with us, and just creating lots of atmosphere, stories, and spirit in that way.
One of the things that we have been involved in Rotary has been the Remembrance Tree Project. And I see that the Christmas tree this year is higher than ever it was. I think it's 45 feet high.
Correct.
But it's such a focal point in the city. And our Remembrance Tree Project has been more difficult this year because we've had to go online. We can't be out on the street looking at people, talking to people. So we've launched an I Donate website, and it's already generated several €100. But the promotion of that is an essential part of our work this year. Is there anything that we can do in connection with YuleFest to enhance our presence in order to generate more funding? So many charities have had to go online, and it's not a natural means for people to give.
Absolutely. Well, Ian, as I said at the start of this, I can completely empathise with your pain of the online world, but I suppose it's something we all have to embrace for now. And the council have Catherine Cooney, who looks after corporate PR, and then Deirdre Dunn is looking at social media. So we can support you with the website online. We can support you with the social media platforms. So anything that you've created, simply by tagging YuleFest Kilkenny, we can then share that out. So really, sometimes I describe YuleFest to people when the website comes together and we've all the program of events, we become the Amazon of Christmas, yes. You know, and we're extending your market reach. So we're pushing your message out there. And that's, I suppose, the best way that we can help you. Other than, I know on the night of the launch, we would have referenced it in the mayor's speech to ensure that he gave it a mention. And equally, Deirdre has a programmed campaign, but I was speaking with her this morning, and I was just saying, is there any other ways? And we find, and everyone would probably agree, you know, video, and I think you've told me that you've created some heart-tugging material, and that's stuff that we can share out as well. So any content that you have, whatever core message you want to get, we can push that out there for you.
Great, that would be very helpful. Colin, as President of the Kilkenny Chamber of Commerce, how do you see YuleFest affecting you this year?
Look, we need things in our city to make us stand out from the crowd.
Yeah,
it's as Paula and yourself have both pointed out, it's very challenging to get people to differentiate ourselves from other cities, especially at this time. But festivals and something around this time is something that makes us stand out and gets us publicity. And publicity for now is something potentially that will bring business now, but also bring it at a later date. It's very challenging to get our message out. It's very challenging to get it out that it's safe, and the shop local message is something that has to keep out there the whole time. So, you know, I'm in Kilkenny 15 years, and I've heard the arguments over the years that, you know, we have too many festivals, too many things going on. We don't have enough, and we need more because everyone else is doing more. There were 552 festivals in Kerry last year. You know, so we're not doing enough. We need to do more, and YuleFest is very welcome, especially at this time of the year.
Yeah, no, I agree with you. You know, that you can never do enough to promote Kilkenny. Somebody once said to me that when he came to Kilkenny in the 70s, there are now more hotels in Kilkenny at present than there were bed and breakfasts 40 years ago. So Kilkenny, it just shows the dependence of Kilkenny on tourism to keep the rest of the economy going. You know?
Look, absolutely. I mean, there are about 800 4- and 5-star hotel rooms in Kilkenny. Up to 2 years ago, there was approximately 1,800 other bedrooms, whether that was 3-star and below, but also guest houses. I couldn't even fathom to guess right now how many rooms and accommodation options there are in Kilkenny because of things like Airbnb that are unregulated. There are. I had a conversation with someone I was interviewing recently, and they told me they were working for a company that I had never heard of in the services side of things. And when I asked them how big that company was, they told me that they had 280 bedrooms in Kilkenny, which is twice the size of Lyrath, and they weren't even on my radar.
Wow!
Even know that they were there. So. Huge amount of accommodation options. Tourism is hugely important to Kilkenny, but just like you said there about their hotel rooms now than there were guest houses back then. We need to remember how small we are and how much growth potential there is. There are more hotel bedrooms in Killarney than the whole of Northern Ireland.
Yes.
Killarney has about 5 times the accommodation rooms that we have in Kilkenny. So there's huge room for growth. In my opinion, we've reached about 50% of our tourism potential. And whilst James has just explained to us how long it's going to take for us to get through so people can travel again, hopefully in 10 years' time, we're sitting down there and we've knocked a hole in another 10 or 15% of that potential.
Great. I wonder, does anyone else have any questions that they'd like to ask Paula? I think you're doing great work, Paula. You're fighting an uphill battle, but you're standing stalwart there. And I think your enthusiasm, not just for YuleFest, but for Kilkenny itself, is really admirable. And I really hope that the work that you're doing generates the amount of goodwill towards Kilkenny and towards YuleFest that it really should do.
Thanks, Ian. Look, since I'm not from Kilkenny myself, so some people often wonder how I'm always in such awe of the place. I married a cat for my sins and I got stuck here, but I fell madly in love with it. And to be really honest, Ian, I think Kilkenny, in my opinion, will be one of the first cities to bounce back. And I keep focusing each year when I worked with the team, whether it's social media or PR, is that we have this unique space. It is a walkable city. It's a beautiful city. Everything's so accessible. And I think that's the key thing that we can sell. But to Colin's point on the festivals, I completely agree. There are counties out there with 500 festivals a year, and it can be anything from a writers' festival to a walkers' festival to a trekkies' festival. You just cannot do enough. And when people go somewhere, they want things to do. Indeed. And you know, people nearly need it mapped out for them. You've got to sell it. But I think Kilkenny is a beautiful space, and I definitely think a very safe place as well. I think there's been a lot of work done which I think is really positive in terms of the outdoor seating areas. And we'll really see the benefit of that in the summer, you know. It's been obviously difficult for the winter, but definitely I would be very confident about 2021 and hopefully seeing a bit of normality as well.
Well, indeed, you know, and I wouldn't say that the work that was done in the market yard was that unsuccessful in winter. On a cold, foggy morning, I think every seat in the market yard was taken. So if people do want to socialise, they do want to do it in a safe way, and the local authority and others have stepped up to provide some facilities for people. There's one thing that while I have a number of people online to ask, if there's anybody out there who knows of a shop window that would take our poster for our I Donate website, we would very much appreciate it. There's one in Willoughby's window, and there's one in Costello's Jewellery. There's some in the Market Cross and in Lochboy and in New Park. We need to get these out, and so anybody who can accommodate one, we would very much appreciate. If you know of an empty shop window, the great thing about these signs is that they have a QR code on it, and therefore if people put their iPhone or their Android phone up to it, their camera phone, it will take them directly to the I Donate website. So that's my sales pitch. If anybody just wants to respond, we'd very much appreciate it. I'm going to draw this meeting to a close, and to thank Colin Ahern and John Hurley and Roisin on behalf of who are here representing Kilkenny Chamber of Commerce, and to thank Paula for her work, and to thank Claire McInerney for introducing us to Professor James McInerney, who I think left a very strong and very positive impression on everybody who happened to hear him today. We will be issuing a recording of this, and I'll circulate it to everyone who wishes to have it, and I look forward to seeing as many as you possible next week. Next Monday is our special general meeting in Rotary, at which President-elect Robert Williams will outline his plans for the coming year. I remember doing this last year, and I had such great plans. But, you know, life happens, and the best we can do is respond to those, as you indeed have done, Paula, in your work with YuleFest. Thank you again for joining us today, and we very much appreciate all that you're doing and all that you're going to do in the next couple of days. Thank you.
No pressure.
Okay. And thanks to everybody. I'm going to draw the meeting to a conclusion unless anybody has any other question they'd like to ask.
No, if I could just say, Ian, thank you for allowing us to be part of this.
It's a pleasure.
Thanks to Claire for putting us in contact and getting this great coup with James here. So just on behalf of the Chamber, thanks so much for allowing us to be involved in it. It's brilliant.
My pleasure.
Great. Thanks again, Claire. Thanks, Colin. And I think we might be bringing you both on board again at some stage before too long. It's easier to do by Zoom when you don't have to be physically present, but we miss that connectivity that physical presence offers. And hopefully before too long, we'll be able to join again in the Clubhouse Hotel for our weekly Monday meetings. In the meantime, thank you very much and look after yourselves.
Thank
you.
Thank you. Okay.